As heavy as is the stigma surrounding HIV, are the consequences of the unchecked mental health surrounding the disease. HIV has long been associated with gay men and high-risk lifestyles dating back to the 80s and the initial outbreak. Now, 40 years later, we are met with the same problems we were met back then, a lack of information causing men and other individuals to be labeled as the outcast or the other. HIV infection happens in 3 distinct phases. The first begins 2 to 4 weeks after infection. Symptoms mirror that of other infections and the body's natural response. Notable symptoms include rashes, swollen lymph nodes, and night sweats. After these symptoms lessen, an individual remains in the clinical latency stage for about 10 to 15 years. Life continues on as normally as possible, but in this stage, the virus remains in the body, destroying T helper lymphocytes, otherwise known as white blood cells. Usually at this point, after diagnosis, is where depression sets in. This is where an individual is left to cope with their diagnosis and mull over their depressive thoughts. Medication is advisable in this stage to help slow down HIV destroying an individual's white blood cells and to help curb the maladaptive thoughts. As the white blood cell count for T helper lymphocytes lessen and lessen over the years, the body reaches the point of acquired immunodeficiency syndrome and is marked by symptoms such as rapid weight loss, recurring fever, pneumonia, and memory loss. HIV is a viral disease, transmitted from one to another through ruptures in the mucous membrane. Commonly, this is done through intercourse, sharing drug injection equipment with someone known or to be suspected of having HIV, or less prevalently through childbirth and breastfeeding, or in a medical setting through direct contact with an infected needle, although this is considerably lower risk than the other risks provided in this list. HIV on the surface has no prevalence with abnormal psych, but studies have a significant link to both depression and substance use disorder. Depression linked due to the life sentence stigma surrounding the disease, tied to no notable cure but low transmission levels and recent scientific breakthroughs. Handling this knowledge is burdensome, and it's unsurprising that depression holds such a strong connection with HIV. Additionally, substance use disorder holds a connection to HIV due to high-risk behavior and the lifestyle associated with illegal drug use, tied to maladaptive coping behaviors and prior negative life experiences. Referencing the pie chart, HIV is most commonly contracted through male-to-male contact at 58%. Secondly is heterosexual contact at 26%. And thirdly is through injection drug use at 11%. Additionally, there is a pattern linking 39% of HIV patients to also suffer from depressive symptoms, cited because of that worsening disease state. Depression hastens the progression of HIV once again because of that life sentence stigma, a mentality of why should I take my medication if it only prolongs the inevitable. However, this thinking is troubling and should be checked medically. Substance use is tied through HIV risk through irrefutable evidence of high-risk behaviors. Opioids and methamphetamine demonstrate the highest risk through direct needle injections into the skin. Cocaine and alcohol are second because they have high association with addiction rates. And lastly, inhalants are attributed to high-risk behavior, especially in the gay community with risky sexual practices and high-risk behavior, linking yet another drug to HIV. Biologically speaking, men are more likely than women to contract HIV, with 77.8% of infected persons being male and only about 22.2% being female. Looking at a population demographic, it's clear that the community most affected by HIV are Black or African American persons at 40.3%. Secondly are white people at 28.5%, and thirdly are those of Latino origin at 24.7%. As stated before, HIV has a high comorbidity with both depression and substance use. Depression is common due to the stigma of the disease and a maladaptive mindset, especially to life after diagnosis. Depression, as a result, is linked to non-adherence to ART therapy and the remembrance of taking daily medications to lessen the symptoms. Forgetting medicine raises depressive feelings and perpetuates a depressive cycle. High-risk behavior remains connected with HIV symptoms due to risky situations individuals have put themselves in the past and may do so in the future. This demonstrates troubled thinking and is advisable to get medically checked. Common medications associated with HIV are antiretroviral therapy drugs. These medications control viral load levels in individuals and can lessen them to undetectable or untransmittable. This can typically be reached in 6 months and has been proven to help extend a patient's life by staying in the clinical latency stage longer. It's been proven to help them remain in that clinical latency stage for about 5 to 10 years, extending their lifespan from 10 to 15 to about 20 to 25 years. Commonly, depression medication is also prescribed as to curb depressive symptoms in patients with HIV. In regards to treatment, cognitive behavioral therapy is recommended as a baseline support to affected individuals. CBT aims to reduce negative thinking and to offer alternative approaches to high-risk behaviors and situations. This therapy works to reframe through education and provide a safe space for individuals to learn. Support groups are also important ways for individuals to connect. HIV support groups give individuals an ability to connect with others going through similar life experiences, as does Narcotics or Alcoholics Anonymous for those suffering from substance use disorders. Constitutionally covered, O'Connor v. Donaldson is a helpful precedent for all patients suffering from mental disorders. This 1975 Supreme Court ruling followed Donaldson as he contested his treatment of 15 years in facility, as he cited intentionally and maliciously deprived him of his constitutional right to liberty. Dangerous to neither himself nor others, he declared the hospital provided no meaningful treatments, therefore he should be able to leave. The Supreme Court upheld Donaldson's position that a state cannot constitutionally confine an individual who is capable of surviving by themselves or with the help of a support network. This ruling protects all suffering from mental disorders regardless of diagnosis, as long as they have proper care or could take care of themselves on their own. They cannot be held in facility. In medical settings, discrimination may occur, so it's important to recognize the signs of discrimination. Discrimination to those with an HIV diagnosis are rooted in age and religious views, subjugated in the stigma surrounding homophobia and fears of drug use and transmission. These are all culminating in a lack of knowledge about the disease, further making those diagnosed feel like the outcasted other. In a medical setting, signs of discrimination are a lack of eye contact, quick appointment, over-the-top protection, and shaming the patient or refusing to draw their blood. More serious grounds of discrimination are physical abuse, denial of care, or sharing a patient's status without their consent. Patients should be relieved knowing that their status is confidential information and cannot be shared without their consent. Patients have a right to reasonable care provided the facility has the ability to do so. This is covered under the Americans with Disabilities Act, as is the right to not have been refused if the facilities aren't present. If that's the case, a patient must be directed to other facilities that can and will assist the patient. They have this right regardless of race, gender, or sexual orientation. Patients also have the right to receive information in a manner accessible to them, view their own records, talk with medical professionals, and have the right to safe treatment or the right to refuse it if they so choose. In terms of psychological wellness, it is not advisable to further contribute to high-risk behaviors such as substance use. Neither is it to self-isolate from the world, nor is it to not take medications that can help reduce viral load levels or lessen depression symptoms. In general, it is not advisable to stop taking prescribed medications without first discussing it with medical professionals. What is advisable, however, is to discover the ways that life is worth living. Talking about your experiences in or out of therapy settings may be beneficial. So is recognizing basic life requirements and practicing self-care. Finding productive and enjoyable activities helps give purpose to life when it may feel hopeless. Additionally, discovering new interests and setting goals may be helpful for patients. So are practices such as mindfulness or finding religion or other spiritual practices if you so choose. All these methods utilize self-development and help the individual refocus their thinking from that of a maladaptive approach to a refocused mindset that discovers that life is worth the journey of stops and not the final destination. Lastly included here are the sources that I have used to put this presentation together. Thank you for your time.